evening. I'm Dr. K. Kumar. I'm a nephrologist from Pondicherry. So I'm going to talk about edema, that is swelling of the legs. What are the common causes? Suppose once you get an edema, what to do? What are the diseases one need to think of, and how to take appropriate consultation. Edema means the legs are swollen, and you may notice it especially in the evening times, or when you're trying to put a tight fitting shoes. You may find it uncomfortable, and sometimes edema will also appear around the eye. So the common reasons why one may get edema are: number one, kidney disease; number two, heart disease; number three, liver disease; number four, the variety of minor causes. So once get an edema, the kidney disease which can present are, we call number one, nephrotic syndrome. This disease is characterized by passage of albumin in the urine. Such a patient may have a frothy urine, passing more urine at the night time, and they may have a swelling. And the swelling may be there in the both legs as well as in the around the face. Second condition where the edema can occur is a chronic kidney disease. Chronic kidney disease is common in people with the diabetes, hypertension, people with the family history of kidney disease, people who consumes alcohol, people who smoke, who takes painkiller. The chronic kidney disease will be usually silent in early stage. Late stages, the patient may have swelling only when he travels long distance or keep the leg in dependent position, that is sit and work for a long duration. Subsequently, the edema may be persistent. This disease is of important concern because if diagnosed early, it can be controlled well. Apart from the kidney disease, next thing to think of is heart disease. Heart disease, whenever the heart function is less, we call it the pumping function or ejection fraction. If it is less, the condition will result in congestive cardiac failure. This also will be characterized by presence of edema in the lower limb as well as facial puffiness. Patient also may develop abdominal distension. This can occur again in diabetic, hypertensive individual with the family history of heart disease. This also is a disease of importance. Another disease of importance is the liver disease. Liver disease, we know, usually the causes are consuming alcohol, people with the biliary stones, some other drugs, including native medicine, they can produce liver disease. Liver disease will usually present with poor appetite, some weight loss may be there, yellowish discoloration of the eye can be present. They can develop swelling. The swelling will be much more in the abdomen rather than in the legs, but they also can, later stages, can develop a leg swelling. Apart from these major causes, edema can appear, number one, idiopathic without any reason, especially in women. In the postmenopausal stage, they can get a mild edema because of hormonal changes. People who stands for longer duration, if they develop dilated veins in the lower limb that we call varicose veins, they also can develop a lower limb edema. Few drugs also can produce edema. The common antihypertensive drug amlodipine can produce mild edema. That also has to be kept in mind. So if someone develops an edema, what you need to do? Number one, just look when does the edema occur. Is it there all the time? It's only in the evening. When does it disappear? Next is how much are you passing urine in normal quantity? Are you having any breathing difficulty or a chest pain? Or if there is alcohol consumption, painkiller take, one has to look at it. Few basic tests like presence of albumin in the urine, renal function test, we call the urea and creatinine. A scan of the abdomen can help to look at a liver disease, and a cardiac consultation. This is a must. So if edema is present, it could be due to some minor reason, but it also may be a harbinger of a major disease. Do not ignore edema. Kindly check your heart, kidney, and the liver so that one can take appropriate measure early so that you can prevent a major disease. Thank you.